Good morning, everyone. I'm so glad you've taken the time to join me today because what we're going to discuss in the next few minutes could quite literally be life-saving information for many of you. You see, I've spent the last 23 years in clinical practice, and if there's one thing I've learned, it's that more people are struggling with high blood pressure than ever before. In fact, 1 in 3 adults in developed nations is dealing with hypertension, and many of them don't even realize it. But here's what really concerns me as a physician. Many of those individuals have been prescribed medications, and yet they have absolutely no idea how these drugs work, what they're doing in their bodies, or whether they're really the right choice for them. Today, we're going to change that. We're going to talk about 3 of the most commonly prescribed blood pressure medications in the world: Amlodipine, Losartan, and Lisinopril. Now, I know these names might sound intimidating or foreign to you, and that's perfectly fine. That's exactly why I'm here. By the time we finish today, you're going to understand not just what these medications do, but how they do it, what kind of side effects you might experience, and most importantly, how you can have an intelligent conversation with your doctor about whether these are the right medications for you. Let me start by painting a picture that I see almost every single day in my office. A patient comes in, we check their blood pressure, and it's elevated. Sometimes it's significantly elevated. We talk about their lifestyle, their diet, their stress levels, their exercise habits, and we discuss that these things matter. But the reality is that medication is often necessary, and when we reach for that prescription pad, we're choosing from a vast array of options. 3 of those options have become absolutely dominant in the treatment landscape, and there are very good reasons for that. Blood pressure, for those who might not be intimately familiar with the concept, is essentially the force that your blood exerts against your artery walls. Your heart pumps blood throughout your body, and that creates pressure. When you measure blood pressure, you get 2 numbers: the systolic pressure, which is the pressure when your heart beats, and the diastolic pressure, which is the pressure when your heart rests between beats. Normal blood pressure is generally considered to be below 120/80 millimeters of mercury. When it consistently gets above that, we start to worry, and for good reason. High blood pressure damages your arteries, it strains your heart, and over time, it significantly increases your risk of heart attack, stroke, kidney disease, and a host of other serious conditions. Now, why do I want to talk specifically about these 3 medications today? It's because they work in fundamentally different ways. Understanding those differences is crucial because different mechanisms of action mean different potential benefits and different potential side effects. And that, my friends, is what determines whether a medication is right for you specifically. Let's start with amlodipine, which is a calcium channel blocker. Now, here's something fascinating that most people don't know. Calcium is absolutely essential for the contraction of smooth muscle, including the smooth muscle in your blood vessel walls. When calcium enters the muscle cells of your blood vessels, it triggers contraction, which makes those vessels narrower and increases blood pressure. Amlodipine works by blocking some of those calcium channels. It prevents calcium from entering those smooth muscle cells, which means they can't contract as forcefully. The result is vasodilation. Your blood vessels relax and widen, allowing blood to flow more easily and creating less pressure on your artery walls. What I love about amlodipine from a clinical perspective is that it's remarkably consistent. It has a long half-life, which means you only need to take it once a day, and it provides smooth, steady blood pressure reduction throughout the entire day. It starts working relatively quickly, usually within a few hours, but it takes about 2 to 4 weeks of consistent use to see the full effect. I've seen it work beautifully in a tremendous number of patients. But here's the thing, amlodipine isn't perfect, and I need to be honest with you about that. It's a peripheral vasodilator, which means it dilates blood vessels throughout your body, and that can cause some characteristic side effects. Some patients experience ankle swelling or edema, particularly in the lower extremities. Others might experience facial flushing or headaches. A small percentage of patients experience dizziness, particularly when they first start the medication. And here's something that sometimes surprises people. It can actually cause reflex tachycardia in some patients, which means your heart rate might increase slightly as your body tries to compensate for the lower blood pressure. I also need to mention that amlodipine doesn't provide any organ protection beyond just lowering blood pressure. That's an important distinction because some of the other medications we're going to talk about do more than just reduce blood pressure. They actually protect your heart and kidneys specifically. Amlodipine is an excellent medication, but it's essentially a pressure-lowering tool. It's not going to improve left ventricular function if you have a weakened heart, and it's not going to slow diabetic kidney disease the way some other agents can. Now, let's talk about Losartan, which represents a completely different pharmacological strategy. Losartan is an angiotensin receptor blocker, or ARB. To understand how this works, I need to tell you about something called the renin-angiotensin-aldosterone system, or RAAS. This is a complex physiological system that your body uses to regulate blood pressure and fluid balance. When your blood pressure drops, or when your kidneys sense that something is wrong, they release an enzyme called renin. Renin triggers the creation of a substance called angiotensin II, and angiotensin II is incredibly powerful. It causes blood vessels to constrict, it tells your kidneys to retain sodium and water, and it triggers the release of another hormone called aldosterone, which also causes fluid retention. All of this serves to increase blood pressure. In the short term, this system is absolutely essential. It's part of your survival mechanism. But in the long term, when this system is hyperactive, it contributes significantly to hypertension and, importantly, to organ damage. This is where Losartan comes in. Losartan is like a lock-and-key system. Think of angiotensin II as a key trying to open a receptor on your blood vessel walls. Losartan is a blocking device. It's sitting in that lock, preventing angiotensin II from opening the door. When angiotensin II can't activate its receptors, the cascade of blood vessel constriction and fluid retention doesn't happen, so blood pressure falls. What I find particularly impressive about Losartan and other ARBs is that they do more than just lower blood pressure. They provide specific organ protection, particularly to the heart and kidneys. If you have a weakened heart, an ARB can help improve heart function. If you have diabetes or diabetic kidney disease, an ARB can slow the progression of that disease and protect your kidneys. This is something I talk about extensively with my diabetic patients because the protective effects are very real and very well documented in the medical literature. Losartan is also generally very well tolerated. The side effect profile is clean. You don't typically see the ankle swelling or facial flushing that you might see with amlodipine. However, there are a few things to watch out for. Some patients experience a dry cough. This is more common with a related class of drugs called ACE inhibitors, but it can happen with ARBs too. Some patients experience fatigue or dizziness, particularly when they first start the medication. And there's one important thing: we need to monitor kidney function and potassium levels because ARBs can affect both. Potassium levels can rise, which is usually not a problem, but in patients with kidney disease, it's something we watch carefully. Here's something else that's important. Losartan has some characteristics that some patients love and others tolerate just fine. It's effective, but it can take a bit longer to reach full effect, sometimes 6 to 8 weeks, compared to amlodipine's 2 to 4 weeks. And when you look at raw blood pressure lowering power, some studies suggest that certain other agents might be slightly more potent, though the difference is usually clinically negligible. Now let's turn our attention to Lisinopril, which is an ACE inhibitor. ACE stands for angiotensin converting enzyme. Remember when I talked about renin triggering the creation of angiotensin II? Well, ACE is the enzyme that actually creates angiotensin II. Lisinopril works by inhibiting that enzyme. By blocking ACE, Lisinopril prevents the formation of angiotensin II in the first place. So while Losartan is like blocking a lock, Lisinopril is like preventing the key from being created altogether. The functional result is similar to Losartan. You get blood vessel relaxation and reduced blood pressure. And like Losartan, ACE inhibitors provide excellent organ protection. In fact, the organ protection with ACE inhibitors is particularly robust. These medications reduce the progression of heart failure, protect against diabetic kidney disease, and have even been shown to reduce the risk of heart attack and stroke in high-risk patients. That's a pretty remarkable list of benefits. Lisinopril has another advantage. It's been around for decades, and we have mountains of clinical data on its safety and efficacy. It's one of the most thoroughly studied medications in the history of medicine. We know it works, we know it's safe, and we know exactly what to expect with it. But I need to be equally honest about lisinopril's drawbacks, because they can be significant for some patients. The most common side effect is a persistent dry cough. This happens in about 15 to 20% of patients. It's not dangerous, but it can be absolutely maddening. I've had patients who can't tolerate the cough and have to switch to a different medication. The cough happens because ACE inhibitors affect not just angiotensin II, but also another substance called bradykinin, which is involved in cough reflexes. Like Losartan, lisinopril can cause dizziness and fatigue. It can cause a condition called angioedema, which is a swelling of deeper skin layers. This is rare, but serious. And here's something important that sometimes gets overlooked. ACE inhibitors can cause a dramatic drop in blood pressure when you first take them, particularly if you're dehydrated or taking certain other medications. We call this first-dose hypotension, and it's why I often tell patients to take their first dose when they can rest for a bit and monitor how they feel. Potassium levels, like with ARBs, need to be monitored, and there's something called a transient hyperkalemia, or temporary elevation in potassium, that can occur, particularly in patients with kidney disease. Now here's where it gets interesting, and this is what I really want you to understand. When I'm deciding which of these 3 medications to prescribe for a particular patient, I'm not just thinking about blood pressure numbers. I'm thinking about the whole person. I'm thinking about their comorbidities, their other medical conditions, their previous medication experiences, and their specific risk factors. If I have a patient with high blood pressure but otherwise healthy kidneys and no particular risk factors, and they're tolerating one of these medications well, they might stay on that medication indefinitely. But if I have a diabetic patient with protein in their urine indicating early kidney disease, that changes things dramatically. Now I'm thinking about renal protection, and both Losartan and lisinopril become more attractive options than Amlodipine because of those organ protective effects. If I have a patient with heart failure, the choice becomes even more specific. Lisinopril and Losartan both have evidence supporting their use in heart failure and actually improving outcomes. Amlodipine doesn't have that evidence. If I have a patient who's developed that annoying, persistent cough on lisinopril, I might switch them to Losartan, which has the same benefits but is less likely to cause cough. And here's something that sometimes surprises people. We don't always pick just one. In many cases, combining medications from different classes is actually better than using a higher dose of a single medication. A patient might be on both amlodipine and Losartan, for instance. The amlodipine provides powerful vasodilation, while the Losartan provides excellent organ protection and blocks the renin-angiotensin system. Together, they often work synergistically, and you get better blood pressure control with fewer side effects than you might get from maximally dosing either medication alone. Let me give you some real-world perspective here. I've been practicing medicine long enough to remember when amlodipine was relatively new and everyone wanted to use it. It's a fantastic medication, and it remains a cornerstone of blood pressure management. But I've also watched the cardiovascular literature evolve, and it's become increasingly clear that for many patients, particularly those with diabetes or heart disease, the organ protective benefits of ACE inhibitors and ARBs make them superior choices, at least from a long-term health perspective. I also want to talk about something that's really important: medication adherence and side effects. The absolute best blood pressure medication is the one that a patient will actually take consistently. I've seen patients on theoretically perfect medications who don't take them because of side effects, and their blood pressure remains uncontrolled. Then we switch to a different medication, the side effects resolve, they take it consistently, and their blood pressure becomes beautifully controlled. That's a real clinical victory, even if we're technically using a less potent agent. This is why it's so important that you're having conversations with your doctor about how you're tolerating your medication. If you're experiencing side effects, Don't just suffer in silence. Tell your doctor. We have options, we can adjust doses, we can switch to different medications, we can add supportive medications to minimize side effects, but we can only do that if we know what's going on. I also want to emphasize something that can't be overstated. These medications work best as part of a comprehensive approach to blood pressure management. Yes, medication is important, but lifestyle modifications matter enormously. I'm talking about reducing your sodium intake, managing your weight, exercising regularly, managing stress, limiting alcohol, quitting smoking if you smoke, and eating a heart-healthy diet rich in fruits, vegetables, and whole grains. I've had patients who made serious lifestyle changes and either eliminated their need for medication or significantly reduced the doses they required. The truth is, I see too many patients who want medication to be a magic bullet that allows them to continue unhealthy behaviors. That's not how this works. Medication controls the biology, but lifestyle controls the underlying disease. And when you combine both, you get results that can be truly remarkable. Let me also address cost for a moment, because I know this is a real concern for many people. All three of these medications have generic versions available, so they're remarkably affordable, even if you don't have insurance. Amlodipine is often the least expensive of the three. Lisinopril and Losartan are similarly priced. This is actually one of the great things about these drugs. They're not expensive boutique medications. They're tried and true agents that have been around long enough to become generic, which brings the price down dramatically. I want to be clear about something else. I'm not here to advocate for one medication over the others. I'm here to help you understand them so that when you talk to your doctor, you can have an informed conversation. Your doctor knows your complete medical history, your other medications, your allergies, your previous drug reactions, and your specific risk factors. That information is crucial in choosing the right medication for you. What I am saying is this. If you're on one of these medications and you're not sure why your doctor chose it for you specifically, I encourage you to ask. Ask your doctor why amlodipine rather than losartan, or why lisinopril rather than amlodipine. Get them to explain their reasoning. A good doctor will be happy to do this because they understand that informed patients are engaged patients, and engaged patients have better outcomes. I also want to mention something about follow-up. When you start one of these medications, you should have your blood pressure checked regularly, not just at home but also in your doctor's office. Home blood pressure monitoring is helpful, but office readings are important too, and you should have your kidney function and potassium checked, particularly if you're on Losartan or lisinopril, and definitely if you have any underlying kidney disease or diabetes. One more thing I think is important to address. Blood pressure medication doesn't cause weakness or fatigue in the way some myths suggest. I'm constantly having patients ask me if stopping their blood pressure medication will give them more energy or make them feel stronger. This is a misconception that can be dangerous. Uncontrolled high blood pressure is what actually causes fatigue and reduces your quality of life by increasing your risk of stroke and heart attack. These medications, when prescribed appropriately, should help you feel better and live longer. I want you to understand that managing blood pressure is one of the most important things we can do in modern medicine. I mentioned earlier that high blood pressure damages your arteries, your heart, and your kidneys. But what I want to emphasize is that this is largely silent and preventable damage. You can't feel your blood pressure being high. You don't wake up and say, "Oh, my systolic pressure is 170. But that damage is happening every single day, every single hour. It's like water slowly wearing down a rock. By the time you feel symptoms, and many people never do until they have a catastrophic event like a stroke, the damage can already be quite advanced. This is why treating hypertension aggressively and appropriately is so critical. We're not just managing a number, we're preventing heart attacks, strokes, kidney failure, and cognitive decline. We're adding not just years to your life, but quality to those years. As we wrap up today, I want to leave you with some key takeaways. First, amlodipine is an excellent, well-tolerated blood pressure medication that works by relaxing blood vessels. It's not for everyone, but for many patients, it's a great choice. Second, losartan is an ARB that not only lowers blood pressure, but provides specific protection to your heart and kidneys through its effects on the renin-angiotensin system. Third, lisinopril is an ACE inhibitor with similar organ protective benefits to losartan and decades of clinical data supporting its safety and efficacy. What I really want you to understand is that these aren't just random pills. They're precision tools that your doctor should be selecting based on your individual circumstances, and you deserve to understand why you're taking them. Now, I know many of you are watching this because you're trying to educate yourselves, and I appreciate that. That kind of engagement with your health is exactly what we need more of. If you found this information helpful, I'm asking you to please subscribe to this channel so you don't miss future content. We're going to continue talking about important health topics that affect millions of people, and if you have questions or if there are specific health topics you'd like us to cover in future videos, please leave a comment below. I read those comments, and your feedback helps us create content that's actually useful and relevant to you. Thank you so much for watching, and remember, your health is your most valuable possession. Don't take it for granted.